Question 1. A nurse in a medical surgical unit is caring for an obese client with a BMI of 42 who is scheduled for abdominal surgery. Which action should the nurse take first to reduce the risk of postoperative complications? A. Encourage ambulation on the first postoperative day. B. Apply sequential compression devices preoperatively. C. Instruct the client on incentive spirometry use. D. Consult with the dietitian for postoperative nutrition. Answer. C. Instruct the client on incentive spirometry use. Question 2. Which task can the nurse safely delegate to the unlicensed assistive personnel? UAP. Caring for an obese client with limited mobility. A. Assessing the client's skin under abdominal folds. B. Educating the client about proper nutrition. C. Assisting with repositioning every 2 hours. D. Evaluating tolerance to ambulation. Answer. C. Assisting with repositioning every 2 hours. Question 3. An obese client newly diagnosed with type 2 diabetes is learning about lifestyle modifications. What is the nurse's priority teaching? A. Start taking insulin daily. B. Increase daily fluid intake to promote metabolism. C. Begin moderate exercise and balanced calorie reduction diet. D. Restrict all carbohydrates immediately. Answer. C. Begin moderate exercise and balanced calorie reduction diet. Question 4. Which obese client requires immediate intervention by the nurse? A. BMI of 35, reports fatigue. B. BMI of 41, shortness of breath and decreased oxygen saturation. C. BMI of 39, reports joint pain in knees. D. BMI of 44, requires larger gown and bed. Answer. B. BMI of 41, shortness of breath and decreased oxygen saturation. Question 5. A bariatric surgery client is 2 days postoperative and the UAP reports that the client refuses to walk due to pain. What is the nurse's best action? A. Request physical therapy evaluation. B. Medicate for pain and reassess willingness to ambulate. C. Notify the provider immediately. D. Instruct UAP to force the client to walk. Answer. B. Medicate for pain and reassess willingness to ambulate. Question 6. Which is the best method to prevent skin breakdown in an obese, immobile client? A. Increase fluid intake. B. Massage reddened areas. C. Place absorbent pads under pressure points. D. Use low air loss mattress and reposition frequently. Answer. D. Use low air loss mattress and reposition frequently. Question 7. During morning rounds, which obese client should the nurse assess first? A. Complaining of difficulty sleeping. B. Has had no bowel movement in 2 days. C. Reports chest tightness and anxiety. D. Has blood glucose of 118 milligrams per deciliter. Answer. C. Reports chest tightness and anxiety. Question 8. Which action is most appropriate to assign to the LPN in caring for a post-op bariatric client? A. Educate the client on wound care. B. Monitor for signs of wound infection. C. Develop discharge teaching plan. D. Perform initial postoperative assessment. Answer. B. Monitor for signs of wound infection. Question 9. An obese client is at risk for venous thromboembolism (VT). Which intervention should be implemented first? A. Encourage frequent coughing and deep breathing. B. Apply compression stockings. C. Administer low molecular weight heparin. D. Teach the client about DVT signs. Answer. C. Administer low molecular weight heparin. Question 10. What is the priority nursing diagnosis for an obese patient undergoing bariatric surgery? A. Imbalanced nutrition, less than body requirements. B. Risk for impaired skin integrity. C. Risk for deficient fluid volume. D. Risk for ineffective airway clearance. Answer: D. Risk for ineffective airway clearance. Question 11. A nurse precepting a new graduate observes improper use of a standard bed for a morbidly obese patient. What is the best response? A. Ask the UAP to help transfer the patient quickly. B. Notify the charge nurse to switch assignments. C. Provide immediate instruction on bariatric equipment. D. Document the incident and take no further action. Answer: C. Provide immediate instruction on bariatric equipment. Question 12. Which client is at highest risk for obstructive sleep apnea complications related to obesity? A. BMI 33, post-hip surgery, no sleep complaints. B. BMI 40, snores loudly and wakes frequently at night. C. BMI 29, hypertensive, on CPAP therapy. D. BMI 36, with no nighttime symptoms. Answer: B. BMI 40, snores loudly and wakes frequently at night. Question 13. What safety intervention is most important when ambulating a bariatric client post-op? A. Have the client ambulate independently for privacy. B. Use a gait belt and at least 2 staff members. C. Encourage rapid movements to increase heart rate. D. Allow the UAP to decide the best technique. Answer: B. Use a gait belt and at least 2 staff members. Question 14. A client with severe obesity is experiencing depression. What is the nurse's best initial response? A. Refer to psychiatry without further discussion. B. Teach about dietary modifications. C. Explore the client's feelings and concerns. D. Encourage the client to socialize more. Answer: C. Explore the client's feelings and concerns. Question 15. Which assessment finding in an obese client should be addressed first? A. Pitting edema in lower extremities. B. Heart rate 110 bpm at rest. C. Fasting glucose 135 milligrams per deciliter. D. Redness under abdominal folds. Answer: B. Heart rate 110 bpm at rest. Question 16. The nurse delegates a task to the UAP for an obese client. Which action by the UAP requires intervention? A. Repositioning the client with 2 staff. B. Reporting a skin tear immediately. C. Massaging a reddened area on the sacrum. D. Helping the client with hygiene care. Answer: C. Massaging a reddened area on the sacrum. Question 17. Which instruction is most appropriate to give a client scheduled for bariatric surgery? A. Begin a high-protein, low-carbohydrate diet now. B. Stop all medications 2 days before surgery. C. Avoid all liquids for 12 hours pre-op. D. Start resistance training exercises. Answer: A. Begin a high-protein, low-carbohydrate diet now. Question 18. What is the nurse's best response when an obese client expresses hopelessness about weight loss? A. You should consider surgical options. B. It's common to feel this way. Let's set a small goal together. C. Try harder. You have to stay motivated. D. Weight loss requires strict control and discipline. Answer: B. It's common to feel this way. Let's set a small goal together. Question 19. A nurse must prioritize care for 4 obese clients. Which one should be seen first? A. Complains of constipation for 2 days. B. Has shortness of breath when walking. C. Complains of back pain after transferring. D. Reports dizziness when getting up. Answer: D. Reports dizziness when getting up. Question 20. A bariatric client refuses to follow dietary recommendations. Which action by the nurse is most appropriate? A. Document the noncompliance and report to dietary. B. Reassess understanding and explore barriers. C. Tell the client the surgery could fail. D. Discharge the client for non-adherence. Answer. B. Reassess understanding and explore barriers. Question 21. A nurse is preparing to administer enoxaparin to an obese post-op client. What is the best action to ensure correct administration? A. Inject at a 45-degree angle into the arm. B. Use a 1-inch needle for intramuscular injection. C. Inject into abdominal fat using a longer subcutaneous needle. D. Use a 1/2-inch needle and aspirate before injection. Answer. C. Inject into abdominal fat using a longer subcutaneous needle. Question 22. Which task is appropriate to assign to a UAP caring for an obese patient with impaired mobility? A. Teach use of a walker. B. Perform range of motion exercises. C. Monitor for respiratory distress. D. Obtain daily weight. Answer. D. Obtain daily weight. Question 23. A nurse is assessing an obese client with gastroesophageal reflux disease GERD. Which finding requires priority intervention? A. Reports of heartburn after meals. B. Coughing and hoarseness in the morning. C. Shortness of breath and wheezing at rest. D. Complaint of bitter taste in mouth. Answer. C. Shortness of breath and wheezing at rest. Question 24. What is the priority concern for an obese client undergoing a colonoscopy with sedation? A. Bowel incontinence post-procedure. B. Reduced sedative effectiveness due to weight. C. Risk of airway obstruction during recovery. D. Discomfort due to prolonged fasting. Answer. C. Risk of airway obstruction during recovery. Question 25. Which nursing action demonstrates proper advocacy for a bariatric client requiring transport to radiology? A. Asking the client to walk to conserve transport resources. B. Requesting standard wheelchair and transferring alone. C. Delaying transport until the shift changes. D. Requesting bariatric transport equipment for safe movement. Answer. D. Requesting bariatric transport equipment for safe movement. Question 26. A nurse is teaching a class on childhood obesity. Which statement should be included? A. Limit screen time to 2 hours or less per day. B. Encourage skipping breakfast to reduce calories. C. Offer high-calorie snacks to promote growth. D. Focus on quick weight loss to prevent diabetes. Answer. A. Limit screen time to 2 hours or less per day. Question 27. Which intervention should the nurse prioritize to reduce atelectasis in an obese post-op patient? A. Apply abdominal binders. B. Restrict fluid intake. C. Encourage hourly use of incentive spirometer. D. Place in supine position. Answer. C. Encourage hourly use of incentive spirometer. Question 28. A nurse is counseling an obese adolescent with hypertension. What is the most appropriate action? A. Refer to a cardiologist immediately. B. Discuss gradual lifestyle changes with adolescent and caregiver. C. Place the adolescent on a strict sodium-free diet. D. Recommend weight loss medication. Answer. B. Discuss gradual lifestyle changes with adolescent and caregiver. Question 29. The nurse is planning discharge for an obese client with osteoarthritis. Which instruction is most important? A. Avoid physical activity to prevent joint strain. B. Apply cold compresses before activity. C. Engage in low-impact exercises regularly. D. Use high-protein supplements daily. Answer. C. Engage in low-impact exercises regularly. Question 30. An obese client on bed rest suddenly develops tachypnea and chest pain. What should the nurse do first? A. Elevate the head of the bed and apply oxygen. B. Check the client's temperature and blood glucose. C. Administer pain medication. D. Notify dietary for NPO status. Answer. A. Elevate the head of the bed and apply oxygen. Question 31. Which obese client should the nurse see first during shift handoff? A. Complains of incisional discomfort after surgery. B. Has blood pressure of 142/88 mmHg. C. Is diaphoretic and has new onset confusion. D. Requests help repositioning in bed. Answer. C. Is diaphoretic and has new onset confusion. Question 32. What action by the nurse reflects safe care for an obese client needing assistance with hygiene? A. Use regular size bed and supplies. B. Encourage self-care and avoid hands-on help. C. Use a ceiling lift device with trained personnel. D. Allow only the UAP to handle hygiene tasks. Answer. C. Use a ceiling lift device with trained personnel. Question 33. A morbidly obese patient with new onset atrial fibrillation is being monitored. Which assessment requires immediate attention? A. Irregular pulse of 102 BPM. B. Client reports sudden chest discomfort. C. Reports needing assistance to the bathroom. D. Hemoglobin A1C of 7.2%. Answer. B. Client reports sudden chest discomfort. Question 34. An RN delegates tasks to a UAP caring for an obese client. Which delegation is appropriate? A. Teaching signs of fluid overload. B. Evaluating skin breakdown risk. C. Documenting calorie intake. D. Assisting the client to the bedside commode. Answer. D. Assisting the client to the bedside commode. Question 35. Which obese client is most at risk for developing pressure injuries? A. Walks twice daily with assistance. B. Sits in a recliner for 4 hours daily. C. Requires assistance to turn in bed every 4 hours. D. Completes active range of motion exercises daily. Answer. C. Requires assistance to turn in bed every 4 hours. Question 36. A nurse is preparing education for an obese client with pre-diabetes. Which dietary teaching is best? A. Cut out all carbohydrates from your diet. B. Replace sugary drinks with water. C. Eat only protein at each meal. D. Use diet pills to reduce appetite. Answer. B. Replace sugary drinks with water. Question 37. Which action indicates an error in prioritizing care for an obese client postoperatively? A. Administering pain medication before ambulation. B. Encouraging early ambulation. C. Monitoring respiratory rate. D. Delaying incentive spirometry until discharge teaching. Answer. D. Delaying incentive spirometry until discharge teaching. Question 38. An obese client is receiving discharge instructions. Which statement by the client indicates the need for further teaching? A. I will walk 30 minutes most days. B. I plan to take weight loss pills instead of exercising. C. I will limit fried and processed foods. D. I'll monitor my weight weekly. Answer. B. I plan to take weight loss pills instead of exercising. Question 39. What is the nurse's best approach when setting goals for weight loss with an obese client? A. Set a target of 20 pounds per month. B. Plan rapid weight loss for quick results. C. Set realistic, gradual goals with client input. D. Recommend fasting to speed metabolism. Answer. C. Set realistic, gradual goals with client input. Question 40. A client with morbid obesity is admitted with cellulitis. Which nursing intervention is most appropriate? A. Cover the wound and avoid movement. B. Keep the legs in a dependent position. C. Elevate the affected limb and monitor drainage. D. Avoid antibiotic therapy to prevent resistance. Answer. C. Elevate the affected limb and monitor drainage. If you found this video helpful, don't forget to like, subscribe, and share with your fellow nursing students. Hit the bell icon so you never miss an update. See you in the next one. Happy studying.